A very warm good evening to our viewers. Welcome to the Evening Review Show. I'm your host, Matthias Aufiko. Well, the African healthcare sector has made significant strides over the years to ensure that healthcare is accessible for all. And over the years, also, healthcare providers have been working on innovative ways to ensure that there are at least advanced solutions to facilitate access to medical assistance remotely. Is a concept called telemedicine. To speak more about this, we have Mr. Rodney Taylor in studio tonight, albeit virtually. He's the managing director of Guardian Eye. Mr. Taylor, good evening and welcome to the show.
Good evening and thank you for having me.
It's a pleasure to have you here. Well, Mr. Taylor, the concept of telemedicine, viewers would probably be wondering, what is telemedicine all about? What is this? What concept is this? If I'm used to walking to a clinic to see a doctor every day for healthcare, what is different about this telemedicine concept?
100%, yes. So telemedicine is something that's been around for some time. I mean, we can go as far back as one of the original early wars, where they actually used a telegram service to actually consult with doctors that got injured actually out in battle. So communicating with a patient, with a doctor not actually physically being with the patient, has been around for some time. But there's always been the challenges, especially in Africa, with regards to the infrastructure and especially connectivity. On the African continent has not always been as we see. We've got in the first world, America and Europe. They have no connectivity issues. But with the cell phone boom that happened across the African continent, that bridge is getting closed drastically. That you can physically now have virtual consultations with a patient and with a doctor. So I think infrastructure and connectivity and mobile cell phones, as well as the internet, has played a big part in what's happening worldwide with healthcare.
Yeah. One would wonder, what type of consultations would this involve? Surely there must be certain ailments which would still require me to go see a doctor physically.
Yeah, definitely. So this is not going to fix everything. You still have your chronic conditions out there. This is your primary healthcare, and that's generally what the African continent requires. It's to access primary healthcare and to get access to it, efficiently and quickly. We often hear people waiting days before they can actually see a doctor. And I mean, I must say, this is not an African problem. I mean, if you go to the UK at the moment, you can wait up to 3 weeks before you can actually see a primary healthcare doctor. So this is a global problem. And with us, that this is a product that's been designed and developed in South Africa. But it's also been using our European partners. So this is a combination of both first world partners as well as third world partners to create this one product that's available for everybody.
Yeah. This the Avahigo medical device, has this been rolled out already on the continent?
It most definitely has. So it's been rolled out in over 20 countries at the moment. It's in its third year. But what has changed is, and this is what happened in South Africa and also in many countries, is when COVID happened, our legislation had to adapt and had to change for the new world and the new problems that we were facing. Because in the past, this is in South Africa's legislation, you were unable to see a doctor unless you had met with that doctor's nurse or if you had actually met with that doctor prior. With the COVID epidemic, I mean, people couldn't get to see doctors, people couldn't get to see nurses, clinics were unavailable. So this is when our products started really rapidly growing at pace, where customers were starting to download our mobile app, and that connected to our digital equipment can be housed anywhere. I mean, that equipment can be in a person's home, it can be in a school, it can be in a corporate. So as long as that device is connected to our app, we can do a physical diagnosis of that patient and not having to have a doctor in the room or even have a nurse in the room. The actual equipment does it for us.
Yeah. Someone might even ask that, but how is it possible that through this device, and how reliable is it for someone to make an informed diagnosis from a distance?
Yes, it's unbelievable how fast this is growing. I mean, adoption is always the first. It's always when new technology comes out, it's always about will the people adopt it. It reminds me when Uber first came out and when Airbnb first came out. It took a while for the adoption process to happen, and then it virtually exploded. And that's what we're finding is happening with AVA at the moment, because we are saying, and also we've got 3 areas that we're focusing on. One, it needs to be reliable. I mean, you asked the correct question there. And our doctors, our European doctors, as well as our South African doctors, are all standing behind the product. We've identified that the diagnosis is as accurate as if the person was sitting in the room with the doctor. We've got an accuracy of diagnosis of over 97%. And if the doctor can't give a physical diagnosis of the data that he's receiving, he then won't give that diagnosis. He will then say, look, it's best that you come and see me, or go into your nearest clinic. So, but no doctor will ever give a diagnosis unless they're 100% certain of what they're going to be diagnosing.
Yeah. You said it's been rolled out for about 3 years now. What are some of the issues that has been picked up in terms of challenges, perhaps, as far as the rollout is concerned? Has there been any?
So the first challenge we faced was a lot of companies have got very strict internet policies, with cyber security and the cyber threats that we face at the moment, whereby we were using companies' physical connectivity. That was one of our challenges, or a hurdle that we had to get over. So what we've designed is the product actually connects to a private network, which is managed by Guardian Eye. So one, it prevents any firewall or port problems that we can't get access to the equipment or access to the doctor, as well as the cyber threats. And there's a lot of privacy acts when it comes to medical information. So we also house information in certain instances. It needs to be in that country. So, for instance, in South Africa, the medical data needs to be based in South Africa. It can't be housed in America. So every country that we're consulting and talking to has got different legislation around, how that data needs to be housed and where it needs to be housed. So that possibly was our biggest hurdle. And then I guess the second hurdle was just people starting to trust the technology. Once they've used it once or twice, they see that it's the same as if they were sitting in front of a doctor in person.
Okay. Yeah. So how do you see this? How do you see this sort of new medical concept? How do you see it transforming the African healthcare system going forward?
So I see it as a product that complements the healthcare industry. When once again, if you look at Uber didn't replace the public transport system. Uber didn't replace the taxi service systems. It complemented an industry that was that required a third option. We are saying AV is the third option in Africa. So if I refer to South Africa, in South Africa we've got our private healthcare facilities, which is often aimed at a certain vertical customer, or somebody can actually afford it. Private healthcare is very expensive, and it's a worldwide problem. So you've got private healthcare practitioners. Then you've got we've got our national health, which most countries offer some form of government health services, same as in South Africa. But those government services are heavily under pressure at the moment. There's not enough access to medical practitioners to the size of the actual populations. And also, it's not very easy to access some of these sites. So what AVA complements the two, because one, we're offering primary healthcare at a radically low price. It's $3 per month. So you have full access to all of our medical practitioners, and it's unlimited, and it's 24/7. And the physical doctors that we're hiring are coming out of the private sector, or they're coming out of the government, the services sector. So you've got a combination of private healthcare doctors, government healthcare doctors working together in a controlled environment within Guardian Eye, and then at a very, very reduced rate of $3 per month. And you're able to access us anywhere in the country. You can get to a cell phone and download our app. You're able to get to our medical doctors.
Yeah. So what are perhaps some of the legislative challenges that you faced since rolling out this product?
So as I mentioned earlier, every country has got its own legislation. We're busy we're about talking to the guys in Mexico City at the moment, and there the legislation is obviously a lot different. So our biggest hurdle is it takes a couple of months for our team to understand the legislation in that country, and for our team to build and design the product that enables us to work hand in hand with that legislation in that country. So every country is different, But at the end of the day, every country is they're wanting to protect their own doctors, which is understandable. So in most countries, we will use those doctors in country. Two, obviously the data needs to be housed in a safe environment within that country. And three, the mobile application also has to be compliant with with all of the stores, which was also quite a big hurdle when dealing with Apple. Apple and iOS was quite a big hurdle when you started to put a new medical app into the store. But I think we've overcome all of those challenges now, and every time we pick a country, we've got a game plan to get that app in that country as fast as possible and complying with what government is requiring from us in that country.
I know you mentioned earlier on about the internet situation on the continent as far as coverage is concerned, and especially the rural areas are normally, if not cut off, they are normally subjected to poor connection that is. What are you and your team doing to ensure that you also reach those in the remotest of areas?
So from a device perspective, I mean the device has got technology to compress the data, so it's generally below 40 megs. With regards to sorry about that. It's the size of the file is 40 megs, so we're able to compress the consultation, so it uses very little data. And we all know about what's happening with Elon Musk coming to the African continent. So that satellite technology that he's going to be deploying across Africa will be brilliant for our product, because then we'll be able to connect up that app anywhere on the African continent, no matter where you are. So we've got big hopes that rolls out. But the coverage in Africa, the coverage is still pretty good from the mobile networks, the SIM provide networks. So there's not many areas that we don't have covered at this point in time.
Yeah. Well, Mr. Taylor, we wait for a short break, and we'll be back for the second half of the show. So stay tuned.
Great, thank you.
Thank you. Well, welcome back from the short break. Mr. Taylor, just to continue our conversation, would you say as a continent we've harnessed the benefits of technology enough to ensure access to healthcare for all people?
I think we haven't even scraped the surface yet. I think with products like Ava, and I mean there's a lot more advancement happening, especially in AI around medical healthcare. I see AI playing a very big role in especially in the African continent, but it's evolving constantly, and it's up to those countries' digital legislation to embrace this. But at the same time, I look what's happening in South Africa. We are not saying that technology is here to replace your practitioners. Okay, we are saying that we need the medical practitioners. The technology and the physical medical practitioners need to work hand in hand for this to be a success. It doesn't work, the technology won't work without the actual human being behind it. So this is definitely not to replace. This is to complement the two technologies. And what we've seen in South Africa, I mean, we've got some of the worst unemployment rates on the African continent. Is with this type of medical technology and with our legislation changing, it allows us to train up people that are non-medical. So you don't require a nurse to actually use our equipment. So we've got an academy. We've got young up and coming people that are coming out of schools and they've got no work. We are taking that group of individuals and starting to train them that they can physically use our medical equipment that then will then be connected to our doctors, and those doctors then will make the diagnosis. We've also got a brain drain, a brain drain of doctors that are wanting to leave South Africa, and it's the same across the entire continent. They seem to think the grass is greener across the ocean, but with AVA and with products and technology like this, you can retain your doctors in your country, you can retain your IP, and those doctors then can work in country using technology and not be leaving our shores.
Yeah. Well, but if I'm a GP sitting at home, why would I not believe that these remote GP consultations will take away my job?
Well, it's definitely going to disrupt. I mean, it is definitely going to disrupt, but it's not going to take away their jobs. It's going to allow them to work in a different environment. It's not the old traditional way of having brick and mortar, very similar to what's happened with online shopping. You still have your shops and your stores. Certain people will still go and shop, but look, I think 25% of transactions now are happening online when it comes to shopping in the African continent. And I see that starting to grow when it comes to medical primary healthcare. It will start growing and growing. It's never going to replace that doctor sitting in his doctor's practice, but it's most definitely going to increase. And this allows us to get to more patients at the end of the day.
Yeah. Well, this sort of online-based healthcare system that we are moving towards not just on the continent, world over, what sort of legislation do you foresee should be in place to protect not only the doctors but also patients who would be making use of these upcoming technologies?
Well, you're 100%. I mean, the legislation that South Africa has put in place has been pretty sound. I mean, it protects both the patients. So, an example, when you're using this technology, us as the company that's created the technology, we can't see the patient's information or patient's diagnosis. So that relationship remains between the patient and the doctor. And I think that's solid foundation. And I mean, that's extremely critical that remains in place, because we have companies now that are starting to use our product, and those companies they're providing it as a benefit for their employees. And I've always said that an employer and an employee relationship has always been intact. That private information relating to that employee's health is always protected and is not compromised. So I think that's a big thing that legislation must stick to. And the second thing is from a price perspective, and I think that's what a lot of the national health programs all about.
Yeah.
It's to get the pricing down that anybody can have access to primary healthcare. So I think that's a big thing. It doesn't help to launch this amazing technology and then it's only priced for the elite. So we've got our 3 A's. This must be for anybody, it must be for anywhere, and at any time. You must be able to have access to a doctor. So with our technology, we are saying within 40 minutes, if you've got our technology on your phone, within 40 minutes you could have had an appointment, been digitally diagnosed by our equipment, being then physically diagnosed by a telephone call like we're having now with a doctor, and have a script or a sick note dispatched to your cell phone within 40 minutes. And that's what we're trying to aim for, is to get people to see practitioners a lot faster to prevent any outbreaks.
Yeah. Of course, we do know that the security aspect is always a very big concern when it comes to engagements of this nature. It's more like someone saying, you want me to share my credit card password or on a site that's not secure and so on. Maybe just for the benefit and for the ease of those who would want to venture into this sort of a telemedicine area. What are the security measures in place? I know you mentioned here the issue of the safety of patients' info and so on. What are some of those things that you have in place to ensure that my diagnosis will not end up on making rounds on Twitter or X, for that matter?
Very valid point. And that's what I'm saying, that people need to trust the technology, but also people need to trust the company they're dealing with. I guess that's a big thing. All that I can say is if a consumer or a company is looking to use this type of technology, just make sure that the company that they're dealing with, one, is reputable, and also make sure that that company is complied with all the digital certificates that's required. So you get your ISO 9001, you get your ISO 27001 So those are two very critical digital compliance or certificates that are required. And that I'm almost saying countries should insist, and most countries are insisting, that those kind of digital cyber practices are in place. So it's the way how we manage that data, make sure it's secure, make sure it doesn't sit in one place, make sure it's in country. And most definitely, that data can't be compromised. And the second part, that we use health data, we keep for life. So as part of our policies, your data is stored with us for life. So you might have been diagnosed 10 years ago by us. That diagnosis will still be there for another doctor to go back and refer to, which is also something which is new to the African continent, because a lot of things these days are still done by paper, filed away in a filing cabinet in somebody's office, where this digital record now is with you for life, and you've constantly got it with you in your hand, which is quite unique for the African continent.
Yeah. So this sort of parallel health systems that we are moving to online and on the ground, what needs to happen to ensure that in terms of the quality of healthcare, that is not compromised?
Working very closely with the with the various health departments in each country. So I mean, in South Africa, I mean, the medical compliance is very high. I mean, South Africa and many African countries have got extremely high quality healthcare. They just don't have accessibility. There's just not enough doctors, and just not enough locations, and it's too costly for the general public to access those facilities. So it needs to be compliant. I mean, even our equipment has gone through vigorous testing by the international accreditation associations like TUV. And in South Africa, there's an accreditation like SAPRA. In America, there's an accreditation like the FDA. So, the company or the technology partner that's supplying this needs to make sure that they comply with all of that to ensure that the healthcare that you're delivering is 100% safe and 100% compliant.
Yeah. So how are the numbers looking since the rollout, whether it's from a patient perspective or from the doctors themselves?
No, it's been extremely good. I always say it's like lighting a felt fire. As soon as that fire starts going, it's very hard to stop. So in our initial trials in South Africa, our trials are based across 5,000 patients. Highly successful. We had a 100% accuracy in diagnosis. And something that also we picked up during those 5,000 patients is the companies that were using us, they picked up a trend that their staff were sick days were being reduced. And the reason for that is quite simple. One, because obviously it's affordable, and also the access is easy because it's 24/7. And the third part was that we are picking up symptoms early on. An example: if somebody we picked up an ear infection, we'd pick up early in the process that ear infection could be rectified very early in the stage. Whereas in the past, that person may not have got into that healthcare as fast, which subsequently then would have them off sick for even a longer period of time. So it's a proactive approach to healthcare, not a reactive. Where most times out there people are reactive when they're ill. And we all know what it's like. We try and self-diagnose. We wait a couple of days, and then we end up going to the doctor. So this is to prevent that type of thing happening again.
Yeah. When you spoke of the cost, I think you mentioned about the $3 per month, and I'm just thinking about the fight of between digital currencies and the conventional banking system. How would that be managed from a legislative perspective, especially when thinking of medical aid providers, service providers?
So currently, So I just gave a price of $3 because the dollar is a recognized currency worldwide. But in each country, we charge in that country's currency. So in South Africa, it would be rands, and here it would be 59 rand 90, which reverts back to your $3 mark at the moment. So we're trying to keep this at a $3 mark, depending on what currency is in country. As I say, we're really wanting this to be affordable and access to everybody.
Yeah. Well, Mr. Taylor, thank you very much for your time this evening, and we're thankful for your brief.
Brilliant. Thank you so much, and thanks for allowing me to join your show, and hopefully your viewers have learned a little bit more about where telemedicine, asynchronous digital healthcare is going in the African continent.
Thank you very much, and all the best with your work. Thank you. Well, to our
Thank you.
viewers,
Good
this is
evening.
from the Evening Review team. Thank you very much for staying tuned. See you again tomorrow, same time, same place.